afternoon to you, ladies and gentlemen. This is O.P. Yadav, Editor-in-Chief of Indian Journal of Thoracic and Cardiovascular Surgery, and we are here in Chennai on the sidelines of the joint annual meeting of the Asian Cardiovascular Surgical Society and Indian Association of Thoracic and Cardiovascular Surgery. It's indeed a singular privilege for us to play host to Dr. Shyam Kolvekar. Welcome, Shyam.
Thank you very much for giving this opportunity to me.
Dr. Kolvekar is Senior Cardiothoracic Surgeon at St. Bartholomew's in London, and he's visiting us as a faculty for this conference. Shyam, I'm going to pick you on a common disease, if I might call it an orphan disease, underreported, undertreated, called Pectus excavatum. So, what are the reasons that this disease, which is so prevalent, is not forming a part of our portfolio?
I think you said it, OP. A basically is not disease, it's a condition.
Okay.
You're born with it, or you developed over a period of time. It never classified as a congenital because as a birth time you may be normal. Over 10, 13 years of time you might get exposed to it and you get it sort of visualized on a chest wall. And that's the reason people are not worried. As a incidence is 1 in 500 to around 1 in 1,000. So if you do the India's population, which is 1.12, should have millions of people. But it's underreported because some people are shy. Like from our culturally, we don't like to expose our people who are crooked or people who have mental illnesses. We hide them, put them in a cupboards, and that may be one of the reasons that if you keep wearing a shirt, you will never expose. And that's probably the reason I feel most of people are shy or not so keen. And it's not life-saving, but I feel if you treat it, it's life-changing.
Okay. Now, do we have any thoughts on its genesis? Any recent thoughts?
Yes, I think there is no gene marker on it yet, but it is commonly occurs with Ehlers-Danlos syndrome or Marfan syndrome or any elastic tissue problems. And we have done some common operations where you do a root and then you correct the chest wall because it's very difficult to leave it that way. Or it's supposed to have, what it happens is when the rib is developing from the side of the chest wall and the cartilages comes to the center of the sternobrae, when they join together, there has to have an inhibition vector which stops it overgrowing it like a shunting.
Okay.
When that vector is not there, it keeps growing it. If you're in the North America or Europe or India, mainly you see excavatum because it's pressed down. If you're in South America, it gets pushed up and you become carinatum. Carinatum is better to have it rather than excavatum if you're going to have one of those, because excavatum does affect you cardiovascularly, but carinatum very rarely does that.
So it has a physiological impact on the cardiac and respiratory mechanics?
Yes, it does. I think there's a chapter in my book which we did with the Springer publication, which is cardiovascular effect of Pectus excavatum. If his Heller index is more than 3.5, it could affect your stroke volume by 20% and lung volume by around 20%. Overall exercise tolerance could be diminished quite a lot. And we see this in people who are fit otherwise as a teenagers. When they come to around 30s, find that they get tired, they have a bad posture, backache, and so many other things. And only thing we can relate to is Pectus excavatum. And if you look at anything, if your circular area in this much, and if you diminish to that, the area under that area, you will be diminished. Same way, if your chest wall is caved in, it will diminish your lung expansion, and it also shifts your heart to the leftward more and can cause effect on a stroke volume. It also affects valves. We have seen people with tricuspid regurgitation, people with mitral regurgitation, and there are people who get arrhythmias. And I have treated few patients who had a cardiac arrhythmia because of Pectus excavatum. After correction of Pectus excavatum, their arrhythmia disappeared.
Okay, and what are the statistics for the natural history, the life table Does it match the background population?
I think the statistics, there was a small paper which was very unknown, but I looked into it, where they did 60,000 autopsy studies. They found around 70 patients who died who had pectus excavatum, which showed, statistically proven beyond doubt, that if you got a pectus excavatum, your chances of dying under 53 are very high compared to people who don't have pectus excavatum. It does have a survival benefit. There are a lot of causations to it and a lot of factors to it, but it does affect on a population. And it was very striking when I